There's two studies that show children who are circumcised early have double the rate of autism. And it's highly likely because they're given Tylenol. So,
There weren't two papers, there was one paper. And the paper was very clear that it was correlation, not causation, because of course I had to read the paper, so you don't have to. But let's do a little bit of logic according to RFK Jr. Circumcision, autism, and Tylenol. We have decreased circumcision in the country and we've increased autism in the country. We have found out in the thousands of papers done in the last few years that autism has to do with about 100 different genetic loci. Maybe he thinks those loci are found in the foreskin of, and maybe because he thinks that's important, that's something that he's worried about. Let's make it very clear. Tylenol does not cause autism. Tylenol, according to the American College of Gynecology and Obstetrics, is the safest over-the-counter drug for women who have fevers, and fevers in the case of pregnancy are deadly. But let's think of the other logic. Tylenol, after this child is born, is causing autism? My goodness, does that mean that when I take Tylenol, I might get autism or be on the spectrum? This is beyond pale. And to think, the one Democrat in a room full of Republicans was making an outrageous statements, and for the first time, and God knows when, all these Republicans didn't call BS on a Democrat. Hard to imagine, isn't it? Let's just be clear. This man has no business belonging as the Secretary of Health and Human Services. He doesn't have a background training, no background in science, and he is absolutely a mouthpiece for his anti-vaccine propaganda. Robert F. Kennedy Jr. saying that circumcision and Tylenol causing autism is proof that ignorance is hereditary if you refuse to learn. This is a problem when you have the Health and Human Services Secretary who does not understand correlation and causation and is trying to make a headline. We need more basic science funding, not less. We need less of people like him that don't understand correlation and causation. And we need more people overall learning science in their classrooms. I'm Dr. Terry Simpson. I like evidence-based medicine. I like science-based medicine. And I can't tolerate this sort of ignorance that comes out of that position. That person should be the individual championing basic science research. Instead, this man is putting forth pseudoscience above real science, histrionics above history, and making a mockery of an office which should be there for the American people. It's a shame.